Dr. Fauci is now, he was asked, this is about a year ago, actually. Anthony Fauci admitted last year that people hospitalized with COVID were placed on mechanical ventilators very, very readily, which might have caused more harm than good. Now, when he says might, what he really means is for sure. And so he also always speaks at mealy mouth language like that, because that's what a con man does, and that's what Dr. Fauci is. But let's hear his answer to this question, if they did anything wrong.
I think the intensive care has improved. We very, very readily would put people on mechanical ventilation when we found out through clinical experience it might have been better just to make sure we position them properly in the prone or supine position and not necessarily intubate somebody so readily, which might have actually caused more harm than good. We learned that as we got more experience. I think the intense
when he says that we learned that, people knew that right away. By the way, he says very, very. He said we were very, very readily, and this person says that should send up the first red flag when you're talking about administering a high-risk intervention protocol like sedation, paralytic, mechanical ventilation, and each very is an order of magnitude above that. Disturbing, to say the least. And then he says every person who died that way should be counted as a medical error death or an accident, not as natural or a COVID death. The lack of interest in finding out how many were killed like this is disconcerting. So he's admitting that into what their practice of immediately intubating people was actually harmful to them, and then they shouldn't have been. And by the way, and he said, we learned this. Well, people knew this. In fact, this is a doctor from March 2020. He was treating COVID patients. He knew this wasn't what they were saying it was. Well, here's what he says.
Suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate. I don't know the final answer of this disease, but I'm quite sure that a ventilator is not it. That is not to say that we don't need ventilators. We absolutely need them. They are the only way at this time that we're able to give a little more oxygen to patients who need it. But when we treat people with ARDS, we typically use ventilators to treat what's called respiratory failure. That is, we use the ventilator to do the work that the patient's muscles can no longer do because they're too tired to do it. These patients' muscles work fine. I fear that if we're using a false paradigm to treat a new disease, that the method that we program the ventilator, one based on a notion of respiratory failure as opposed to oxygen failure, that this method, and there are a great many number of methods we can use with the ventilator, but this method being widely adopted at this very moment in every hospital in the country, which aims to increase pressure on the lungs in order to open them up, is actually doing more harm than good. And that the pressure we are providing to lungs, we may be providing to lungs that cannot stand it, that cannot take it, and that the ARDS that we are seeing, that the whole world is seeing, may be nothing more than lung injury caused by the ventilator. Now,
so there you have it. That was known back in March. What, Kurt, you want to say something?
Did you not see that nurse's video out of New York in the hospital where she recorded her coworkers because somebody died that got put on that, and she was crying about it. She was, they're putting all these COVID people. It's like the old folks' homes. They were packing all these people without COVID were getting it in the hospital, and they just kept saying upper management said do that. So basically, I think it's like $40,000 or something a pop.
That they would get paid per person who was on an intubator.
Yeah, yes.
So let me bring in Dr. Kory. What can you tell us about how that became the protocol to treat people and have no other treatment? By the way, they would give them no other treatment. So tell us the story behind this.
Okay, so I was the chief of critical care service at University of Wisconsin. I was also director of the main ICU, and let me tell you how it played out in Wisconsin. When COVID was coming to Wisconsin, we saw what was happening in New York and Seattle and Italy, and we saw all these ICUs filling. Okay, here's the deal. When we started getting our first patients, I could see I was in charge of about 17 ICU specialists, and they were all very nervous. Let's go back to the fear, Jimmy. And what happened was one day, a couple of them came up to me and they said, Pierre, we think we need to set a trigger for ventilation of anyone who's on more than 6 liters of oxygen a minute. And I looked at them and I said, that's absurd. Because I got to tell you what that doctor just said, Dr. Cameron Kyle Seidel, he nailed everything. And by the way, a good intensivist, an expert at respiratory failure, knew exactly what he was saying. I mean, I had the same impression within 2 patients of this disease. And so I actually held a meeting with all the intensivists and I said, we will not be having an arbitrary trigger to put people on ventilators. And I reminded them, I said, the only indication for mechanical ventilation is work of breathing. It's when a patient cannot sustain the work of breathing. And sometimes that's hard to assess exactly when that point is passed. But I said that's always been the foundational principle, and we're not going to forget it. Sort of, you remember how they forgot natural immunity overnight?
Yes.
Well, here's the thing. Of the many arguments and public debates I've been in COVID, that one was pretty short and no one disagreed. And actually, we never did that at University of Wisconsin. However, what he also said is correct. It's that appeared to be widespread early on. I think it was somewhat fear. It's also ignorance. I think they don't understand mechanical ventilation, what its role is. I also think it gets convoluted with, they think they were worried about these patients spreading COVID, because once you're on a ventilator, it's a closed circuit, and actually all the exhale breath goes through a filter. And so that could have been another incentive. But I want to be clear on another thing, Jimmy. At the beginning, when the widespread early use of mechanical ventilation, there wasn't a financial incentive in play. And I have to tell you, on average, most doctors will not use a hospital's financial incentive to make that decision. Now, could it have happened that as they made guidelines in certain hospitals, did an administrator have a seat at the table and somehow influence some sort of arbitrary oxygen trigger? Certainly could have happened. But remember, this was not a national policy. It wasn't Fauci's policy. But I saw that fear in the beginning, and I saw people racing to put people on ventilators. But the thing is, Fauci did say a couple of other correct things, is that people figured it out early. So I stayed at Wisconsin for about 3-4 weeks in COVID. I left because of what you said. The institutional policy was what was called supportive care only. Fluids, Tylenol, food, oxygen, ventilators. They would not want to try treatments. They didn't want to use blood thinners when we knew they were clotting. They for sure didn't want us to use corticosteroids. And I said it was absurd. And I actually resigned out of a moral and ethical objection. I said, I refuse to be a clinical leader if you're not going to treat this disease. And the point of my story is I then left and I became an emergency volunteer at New York ICUs. And by the time I got there in mid-April, my colleagues it's the hospital I used to work at and I trained at and I trained people at for 10 years. When I went back there, all my old trainees and colleagues, they had already figured it out. They were not putting people on ventilators. In fact, we were keeping people on high fractions of oxygen using other non-invasive devices. And we had people working. I mean, they were breathing 40 times a minute. But if they're reasonably young and strong, we really, that was the last thing we did. So the practice really did change quickly in some places, because I've also heard stories where they were doing early intubation months into the pandemic. But I got to tell you, good clinicians who were worth their salt and know their specialty figured it out very quickly. You don't put someone on a ventilator on an arbitrary oxygen limit.
So where does the push? So, okay, my personal doctor was also treating COVID patients and was told not to use any treatments, not to use steroids.
Correct.
And
correct.
My personal doctor ignored that guidance and treated her patients anyway. And they came to reprimand her. And she said, yeah, your patients are dying and mine aren't. And so where does that come from, doctor? Where does this push nationwide to not treat people with a novel virus that nobody knows how to treat it? Why would there be such a push to restrict doctors from practicing medicine? Because that's what that is, right?
Yeah. So the only defensible way you can understand it, there's indefensible ways I could explain it to you, but it's a perverse emphasis on do no harm. And when I say perverse, modern academic medicine has this hegemony, this dominance of the large double-blind randomized controlled trial. And so doctors, and most of them are conservative, they're rule followers, and they never want to hurt someone, they never want to make a mistake, right? They felt that in a novel disease without proven treatments, it would be wrong to try something because they felt that the harms might outweigh the benefits. But here's the thing, you're absolutely right. That doctor's right. When you saw in that early pandemic, the first publication, which came out of Northwell Health in Long Island, they had an 88% mortality rate of ventilated patients. Those patients were dying of lack of treatment. It was so clear that the risks of not treating were so high that you had to do reasonable things that you knew were counteracting the mechanisms. But I got to tell you, this is what my bosses told me at University of Wisconsin. And this is why I left, is they kept telling us, do not try treatments until we know what works. And they're telling us to wait for randomized controlled trial when we're in a war. People are dying everywhere, and we knew they were dying of lack of treatment. But again, Jimmy, I don't understand the world. Like, to me, it was so simple, it was so straightforward, and yet nobody was looking at it my way. They were all happy to wait for Emperor Fauci to do some trial to tell him to use some drug. And by the way, this isn't just COVID. I see it in a lot of other areas, even stuff that we find that works, that has really good evidence that's safe. They will not do it until some big high-impact medical journal has some shiny, big randomized controlled trial done by pharma investigators, right? And then they'll adopt it. I mean, the whole thing is corrupted, Jimmy. It's really sad.
So wait, that means you just have to buy off that part of the system,
Yeah. So go ahead.
Yeah. I don't know how to change that system. I mean, that's based, it's something called evidence-based medicine, which was kind of came into, focus and emphasis in the 90s. But it's been perverted, and it's been perverted to keep this huge randomized controlled trial at the pinnacle. And now they don't listen to any other evidence, and for sure, no anecdotal evidence. Like, even if I gave someone like a bolus of steroids and they turned around the next day, improved oxygenation, got off the ventilator, if I tried to tell colleagues, hey, I think steroids are working, nope, can't do it. It's anecdotal evidence.
Isn't that around the time they started advertising drugs on TV in the 90s?
In the 90s?
When that term, because that sounds like a corporate term, like
evidence-based medicine,
gender affirming care, pain management, stuff that kind of stuff, breakthrough infections.
Yeah. So I want to show. So you were one of the people advocating for the use of steroids. You were out in front on that. You even testified in front of Congress.
I testified in the Senate. And hold on, Jimmy, I testified at a time when every national and international healthcare organization in the world was saying, do not use corticosteroids. We knew they were critical. We knew they were life-saving.
So,
and I got killed for that. I got harassed by my university for saying that, and I was proven right 2 months later. But
did anybody apologize to you after that at the university?
Absolutely not.
No. So so when you say you think it's just doctors being overcautious, I think it's way more nefarious than that. They didn't want anybody to try anything. This is my theory. They didn't want anybody to try anything because something might work, and then they wouldn't be able to get their emergency use authorization for their $200-300 billion vaccine rollout that was coming. And so that's what people like me think. But then again, I'm a cynic.
Well, see, what I'm testifying to is what my bosses were like, and I don't believe they were. It's because Fauci had their ear. I think there was just this innate, extreme misplaced conservatism about adopting new strategies without evidence. They're just too scared. So I think that was one aspect, but I don't disagree with you at all, because there's a wealth of evidence to show that they suppressed and distorted any evidence of any other treatment working except for Paxlovid, Molnupiravir, and the vaccine. That is inarguable. And also, another interesting thing about the steroids, I don't want to go too deep on this, but that trial that proved that steroids were life-saving, I actually believe, and I'm sorry to go to conspiracy theory, I actually believe that trial was designed to show that steroids don't work. They use such a low dose of a steroid for the patients in the most severe disease that I think they were hoping it wasn't going to shown to be working. You know what? It actually showed to be life-saving, even at that low dose. But I do believe that was a corrupt exercise, and they failed at it.
And they did similar things with, for instance, hydroxychloroquine and ivermectin. They set up these studies. A lot of people say set them up to fail. But there's also so if you go back to 2005, well, here, I'll show it to you. Let me just jump ahead. If you go back to 2005, this is from the NIH. It says chloroquine is a potent inhibitor of SARS coronavirus infection and spread. That's from 2005. So that wasn't in real world. That was in the in vitro or in a petri dish somewhere, right? And so that wasn't proven to actually treat real world, and it wasn't proven to treat COVID-19. But that's why Trump said that, and that's why people were saying that. But then they made people think you were crazy if you said that, even though there was lots of publications that said that it would treat it. So, and the same thing with ivermectin. They made it out to be something it wasn't. They made it out to be a veterinary medicine, which it is, but it's also a Nobel Prize winning human medicine, which they always left that part out. And that's another way to lie.
Well, the first one was a fish tank cleaner, and the second one was horse goo.
Yeah,
There's
said
a new insult word for each one.
That's right.
You don't even need to look into it.
That's right. And it catches on like wildfire. So they made hydroxychloroquine out to be fish tank cleaner because they found some people in Arizona who tried to use fish tank cleaner instead of the drug hydroxychloroquine. And so that cemented it that you were crazy.
Kill her husband with it or something.
And then they showed that, and then they also showed people were getting sick from taking the veterinary ivermectin. Of course, this is all propaganda by big pharma funded media, right? And that's exactly what this is. And then they smear anybody who actually brings up the science. I was smeared for bringing up ivermectin. Go ahead, doctor.
Of course you were. No, because what I'm saying, what you're describing is well described in the article, The Disinformation Playbook. It's written on the website of the Union for Concerned Scientists, and it goes over 5 tactics that industries use when science emerges that's inconvenient to their interests. And they name them after American football plays. So it's called the fake, the fix, the screen, the diversion, okay? And those plays, those tactics were invented in the 1950s by the tobacco industry.
Oh.
And remember, they had 50 years where they tried to inject doubt around the toxicity of tobacco, right, until the master settlement, right, in the late 90s, early 2000s, right? But for 50 years, they were publishing studies trying to demolish or suppress the evidence of toxicity or right, of all the disease. And all of those tactics, that's what my book is about. Is basically, I'm using ivermectin as a case study. And the book really, although it's about ivermectin, it's not about ivermectin. It's about what they do to threats to their business model and repurpose drugs. So the war on ivermectin, that's the second war in COVID. The first war was the war on hydroxychloroquine. Mm-hmm. Right. And they've been doing this in numbers of disease models for decades. And I would say the pharmaceutical industry is the most expert practitioner of disinformation. They have the media, they have the journals. Once you have the media and the journals, you can basically get people to believe anything. And here's the trick that they pulled with ivermectin. 95 controlled trials of ivermectin, 123,000 patients from like 23 countries around the world. The only studies that drove headlines were the big agency studies, like by the NIH and these big funded studies, all done by pharma conflicted investigators. Many of the investigators actually held stock in competitors to ivermectin and or were employed by competitors to ivermectin. These are the people they chose to study, a dollar drug that would decimate the business model of their paymasters. I mean, the bias and the corruption is so obscene. And Jimmy, again, I didn't know the scope and the scale of this going into COVID. I always knew, big pharma's bad. That we know they're corrupt. We know that they pull a lot of hijinks. We know they can pull frauds. I didn't know that they've captured the entire system of science around therapeutics. And they will get you to believe that vaccines are safe and effective. They will get you to believe that ivermectin is an ineffective horse dewormer, and this is what they do. And they do it with the biggest authorities in the land, right? The mouthpieces of the agencies, the banners of the most highest impact journals in the world, and they're playing a big con. And I didn't realize the depth of the con, and it was only my expertise in ivermectin where I suddenly started to see unmitigated, relentless lies surrounding me in a 360-degree vision, blaring from every newspaper, every radio, every late-night talk show host. That horse dewormer campaign was a public relations campaign. It was completely designed, and you know what triggered it, Jimmy? It got triggered August 21st of 2021. There was a report that came out a week later showing that ivermectin prescriptions in the United States hit 90,000 a week, which was huge. They saw that the country and the doctors were figuring out out that ivermectin worked. And what they do, they launched that PR campaign. And I'll tell you, after the horse dewormer campaign, the conditions on the ground were very different. You know, the AMA went in, the American Board of Pharmacy went in, they sent out a directive. We call a halt to prescribing of ivermectin right now. They have no authority to do that. But within a week, you couldn't get an ivermectin prescription filled at a retail pharmacy. All the doctors were too scared to prescribe because they were going to lose their jobs. I mean, they can intimidate the entire country to doing their will. And look at me. I stood up. I kept fighting back and speaking up. But look, my career in that system is over. Paul Marik, my colleague and mentor, his career got ended. Umberto Meduri, one of the world experts on the use of corticosteroids, his 40-year career, the Veterans Administration, they forced him to resign, and that came down from Washington. These people don't play. I mean, they literally ended our careers, and we were some of the most celebrated and published doctors in our specialty. And this is what happens.
Yeah, so that's the scary part, right? So even the top doctors, you think you would have some immunity from this kind of propaganda from people like the big pharma-funded Fauci's and Collinses and those types of people. You would think being the leader in your field would give you some kind of immunity from that kind of stuff, but it does not.
I thought so.
All they do is they call their tools in the corporate media and they say, do a smear piece on this guy. And there you go. They got a smear piece. And now you think Dr. Robert Malone, who was the pioneer in mRNA vaccine technology, holds multiple vaccine patents. Now he's some kind of a kook. They made him out to be some kind of a crazy person because he's got a counter narrative to what the big pharma says. Go ahead.
No, I just agree with everything you're saying. I mean, Peter McCullough, the most published cardiorenal specialist in the history of the specialty, he actually founded the Society for Cardiorenal Medicine. Guess what happened in COVID? They disbanded the society. It just disappeared. The society that he had built. He lost jobs. He was the vice chair of medicine. And then they tried to sue him afterwards. And I mean, literally, we were celebrated throughout our careers. And then suddenly, because we were speaking the truth and we were departing from a consensus, I've read all the hit jobs. They use the same words: fringe, quack, rogue, right wing. I don't know where right wing comes from because science is not politics, but suddenly we're right wing because we have some alternative view on the science. And it's relentless. But that's the thing, Jimmy. They can take down anyone. Doesn't matter what you've done in your career. Doesn't matter how celebrated you are. They will take you down.
I see it happen. Look what they did to RFK Jr. Look what they're doing to everybody. Yes. Except I think they overreached with COVID, and they've injured so many people through their COVID policies that I don't think there's any way for them to actually retain this narrative control. I think now you're seeing documentaries come out. You're seeing books like yours coming out. You saw the real Dr. Anthony Fauci book was a #1 bestseller for months. So I think that you have people, the #1 news show in America on Fox News, Tucker Carlson, has been telling the truth about it. And so there's I hope, like maybe this is me just hoping, that they won't be able to control the narrative on this much longer, and that hopefully somebody will be held accountable for this, because they lied about they lied and said it prevented transmission. And in the data, in Pfizer's own data, they didn't even check for it. And now there's the latest stuff that they're revealing that they didn't check for anything.
It was an emergency.
They didn't
We're
check.
moving at the speed of science.
Yeah, they didn't check to see how it affected anything, right? Can you speak to any of that, the latest data that's come out?
No, I mean, I've done some deep dives into the trials. Other people have too, Naomi Wolf and the Daily Cloud. I mean, what they did do is they discovered a lot about the vaccines, which they buried, manipulated, and suppressed, right? What they did around the adverse events, they could see people getting injured from early on. I mean, come on, when those things were rolled out late December 2021, theirs exploded overnight to an extent we've never seen before. I mean, the amount of reports were just absolutely overwhelming. The death reports within weeks hit the hundreds, right? Remember, we cancel baby formula after a couple of babies purportedly die. We take back 300,000 cars when the muffler's faulty. And the suppression of the adverse event data was the most remarkable. And then the overinflation of its efficacy, that's pretty standard for pharma, right? I mean, that's what they do. I mean, the thing is, the campaign had predetermined results, right? Which is that their objective was to get the vaccine in as many arms as possible.
Right.
So anything that stood in your way, any inconvenient data had to be either suppressed, distorted, or manipulated. And the vaccine, and that's the thing. It's the ivermectin was the enemy of that vaccine campaign, and not just ivermectin. Any effective early repurpose.
That's right.
Hydroxychloroquine was the first enemy, right? Because not only if let's say they played by the rules, we know that the EUAs could not have been issued if you had an effective drug, but they wouldn't have played by those rules.
The emergency
they would have rewritten those rules.
The emergency use authorization is the
Yes. Mm-hmm. I'm sorry. Yeah, for the vaccines could not have been issued if there had been identified an effective early treatment drug, right? That's if they played by those rules. But they knew that if any evidence of efficacy came out around it, that it would drive their number one enemy, which was vaccine hesitancy, which we knew that was their number one enemy from the Event 201, the simulation exercises for the next pandemic. Vaccine hesitancy was like such a huge part, and they knew they had to use media. They knew they had to manipulate information, and you're seeing basically 3 years of propaganda and censorship to prop up and defeat vaccine hesitancy. That's why people like me, and I didn't know that I didn't know I jumped into the middle of a world war on repurposed drugs. I had no idea. I thought I didn't think I was going to get a ticker tape parade, Jimmy, but I thought people would be like, "Hey, good job, man. Thanks for this," and they would just deploy. Oh, you guys are laughing at me, right? Because it's funny. But that's literally what I thought back then. And after my ivermectin testimony and our organization started to get a lot of attention, nothing was making sense. It just seemed to be endless attacks, and we were just getting this retaliation without gratitude, without thanks. And then I just started to see the lies. And that's what really got me to start seeing deeper. But going back to your point, Jimmy, about the exposure, I am optimistic. I think the amount that if it exposed what it exposed to me, it's exposed to a lot of people who were not aware of this. And I do think we're going to be a cadre or a huge growing population in this country of people who are aware of what they do and what they're capable of. And I hopefully will protect ourselves from the next bunch of tricks that they want to pull or the next fraud that they want
to pull. It's coming, believe me.
For whatever age. I know it's coming.
It's coming.
But we're smarter now, Jimmy.
Bill Gates is onto it next. Well, now we know. We know how the game works with Bill Gates. We know how he buys up the media. He funds the research for the vaccine. He funds the vaccine. He invests in it. And then when he funds the trials, and then he funds the media reporting on the trials, and then he funds the WHO, who then gives the mandate that everybody has to follow. We have to follow the WHO rules at YouTube. And it turns out that's coming straight from Bill Gates. And anytime I try to tell the truth about Bill Gates, they suppress it and demonetize it.
And can I add one other thing that he did? He is one of the guys who helped fund one of the largest trials on ivermectin, one of those multi-center, double-blind, randomized control trials. He helped fund the largest one. And guess what, Jimmy? Imagine this. You know what they found out?
No.
That ivermectin wasn't effective.
It was not effective? His trials?
Yeah, exactly. Well, the big trials that drove all the headlines were all negative. Of the 95 trials that there are, the overwhelming signal is repeated benefits. And when you summarize them, I've never seen such an effective drug. It's the most proven drug in any disease model I've studied. Yet the newspapers and the average doctor and average citizen thinks it's a horse dewormer, and that the large, rigorous trials showed all those dumb doctors like me that our little overenthusiasm about ivermectin was misplaced because the science has determined that ivermectin is ineffective. But that's what I'm saying. It's I call it in the book, I call it the big six. There's literally 6 trials that support that entire conclusion that ivermectin doesn't work. And when you look at those trials, they use the same tactics in every trial. They're all trials designed to fail. They're all done by hugely pharma-conflicted investigators. And then they all get represented as the best science on ivermectin.
Well, I got to tell you, the 6 big trials are right, that ivermectin does not work. And that's the science. It doesn't treat COVID-19. And I'm going to follow those 6 trials because that's what the science is. And certainly YouTube knows better than you do, someone who treats people and is a leading doctor. I mean,
not anymore.
I'm sure not anymore.
I like to thank Bill Gates also for putting his own money up to figure out if it works. Because he could have lost a lot of money on that.
He could have lost a lot of money on that. That's a lot of guts in Bill Gates putting his own money up to find out ivermectin doesn't work.
So now we know.
Now we know for certain that it doesn't work, no matter what your experience was treating all those patients, no matter what any other person said, or the other 90 studies. Don't ignore those. They're wrong. The real science is that ivermectin does not work, and it does not treat COVID-19. Go to jimmydore.com to see my new stand-up special, COVID Lies Are Funny. For only $10, you get to become a premium member, too. And come see us do our live shows. We're going to be doing stand-up comedy in Milwaukee, Nashville, Honolulu, Los Angeles, Northampton, Massachusetts, Syracuse, New York, Cohoes, New York, Hartford, Connecticut, Baltimore, Maryland, and more. Go to jimmydore.com for a link for all those tickets.